Let's talk about jaundice. Okay, there are three type of jaundice. One is pre-hepatic, hepatic, and post-hepatic. In pre-hepatic, okay, indirect bilirubin is increased, fine. In post-hepatic, direct bilirubin is increased. Direct means conjugate, okay, and indirect means unconjugate. In hepatic jaundice, both direct and indirect bilirubin is increased. Now let's talk about urine bilirubin. Urine bilirubin is seen in hepatic jaundice, okay, and it is absent in pre-hepatic but seen in post-hepatic. That means urine bilirubin is seen in both hepatic and post-hepatic. Okay, pre-hepatic don't have a urine bilirubin, but pre-hepatic have a higher concentration of urine urobilinogen. Though urine don't contain bilirubin, but it contains urobilinogen. So if we go from pre-hepatic to post-hepatic, the concentration of urobilinogen in urine is highest in pre-hepatic, then hepatic, then post-hepatic. In fact, post-hepatic urobilinogen is absent. Fine. Now see this diagram. It is basically a circuit tape. Okay, it used to measure some child, severe acute malnutrition child. If the value is less than 11.5 centimeter, child is named as an undernourished child. It is used by a frontline world field worker, for example, ASA worker. Now let's talk about neonatal sepsis. Fine, neonatal sepsis is a early onset or late onset. Early onset, that's usually within first 3 days, and basically the source of infection it's a maternal genital tract, and the baby suffer from pneumonia. Late cause of sepsis are seen after 3 days, and it is mainly because of a community acquired or hospital acquired, and this is very severe. The baby suffer from meningitis, septicemia. Okay. Now let's talk about intrauterine growth restriction. It is two types, symmetric and asymmetric. Symmetric means everything is affected from brain to toe. That means brain is affected, baby weight is affected, baby height is affected. Okay, and in this case the ponderal index will be 2 or more than that. And the causes of this is basically either it can be genetic cause, for example chromosomal abnormalities, torch infection, toxoplasmosis, rubella, congenital cytomegalovirus, like that. In asymmetric, it's called asymmetric because brain is not affected, fine, and brain is since not affected, the ponderal index will be less than 2. It's mainly caused by the maternal medical condition, for example maternal diabetes, maternal hypertension, preeclampsia, placental insufficiency. And the causes or etiology that affect the baby that causes baby to suffer from symmetrical iugr, whatever the etiology. For example, torch infection is the etiology for symmetric iugr, so they only affect the baby in early phase or period of gestation. Okay, and symmetric iugr is seen when baby is affected by etiology, for example maternal insufficiency, preeclampsia, in late part of period of gestation or late part of pregnancy. Fine.